Thank you.
You're up.
She's right. Until midnight. So worth it. Worth every waking minute. Feel bad. I know. I feel bad for anybody else. Yes. Like if we meet other people. There's my story.
Well, let's see what happens to them next week against BJ Flag.
Oh, they got this one. Mission was that good? Defense or
And then what was the other one? They're all
But I did it for a great job of it, right? It was 100%. We don't have chat for last year.
Okay, so it is welcome, everybody. Hello. Hello. Welcome everybody to our second of series in our elder care program, and I am delighted this morning to welcome Dr. Adrienne Solis-Sherman, who is Advanced Care Planning Manager for the Senior Care Partners, PACE, and she will tell you what PACE means as well, because it is so long we couldn't even put it up there. So welcome and thank you for coming.
Thank you so much. I'm Adrienne. It really is a privilege to be here. I'd like to take just a few moments to share a little bit about my background so that you know who's up here chatting with you today. And to thank you for this opportunity. I'm very passionate about connecting with our community and ensuring that our seniors can age in place. And so I'm going to talk to you a bit about that as well. So my background is in nursing. I have been a registered nurse for almost 20 years. And I've worked in a variety of settings, inpatient and outpatient, and I have spent the last 10 years of my career specifically working with hospice and end of life, both at the bedside and in an administrative role as well. So back in April of this year, I hired in at Senior Care Partners PACE. It's a really wonderful organization. So I'm excited not only to share, a bit about that program, but also some other adjunct or supplemental things in case, PACE isn't a good fit for everyone. And so with that, I'll just kind of jump into what PACE is. So PACE is a national program. It's not something unique just to Michigan. There are roughly 155 PACE organizations throughout the United States, and 350 PACE centers. So for example, Senior Care Partners PACE is one organization, but we have 4 centers in Portage, Kalamazoo, Battle Creek, and then Albion. So the goal of the PACE program is to help our participants age in place. We know that we can improve the quality of life by helping people stay in their homes. And so we offer a wide variety of interdisciplinary services that really kind of wrap our arms around each participant and their family everyone has unique needs, and so our goal is to, meet you where you are. So I know one of the questions, or Yvonne had mentioned, sometimes it's challenging if you have loved ones that are living in another state, and how do you, care from afar, if you will. And so depending on the state that your loved one lives in, they may or may not have a PACE organization there. I included the two that are closest to you, and then they're also on your brochure, but one is right here on Millam, just a couple miles down the road, and there's also one in Kalamazoo. So our mission is to empower independence and autonomy, and we really do care for not just the participant, but the whole family unit. And we recognize that not all of our participants have, even family members or close friends. We do have participants that are all on their own, and so their needs vary, drastically from someone that has the supports of their family or a wider support network, if you will. But the way that we do this is through interdisciplinary care and really geriatric care that is highly specialized. So this is all in your brochure too, but I do want to go through some of the really wonderful things about our program. There's a lot about our program that I appreciate. First and foremost, it is that the care, like I said, is tailored to each individual's needs. So we offer, of course, medical care, certainly, but it is much more than just medical care. We also offer nursing and social work. From a physical rehab perspective, we have physical therapists, occupational therapists, speech therapists, and those services are available both at the day center in the clinic area as well as in the home setting, just based on needs. We have registered dietitians, so every participant that comes into our program is assigned a registered dietitian to assist with any nutritional needs that they may have. Certainly personal care services and home care, light chore keeping, a variety of things, again, based on individual needs. We also have a pharmacist on staff, and we have some really wonderful spiritual care providers as well. We offer transportation for medical appointments, so transportation to and from our day center or to specialist appointments. It's not uncommon to need to go see your cardiologist or, an eye doctor. And so we arrange and facilitate the transportation for those as well. Our day center, so each location has a center. It is a medical clinic, but it is also so much more than just like a doctor's office, if you will. So it's a place where our participants can go and socialize. I think one of the areas where we get it wrong in healthcare in general is the really crucial aspect of socialization and how important that is, not just for our elders, but just in human beings in general. So the day center offers a lot of different activities. We have recreational therapists that plan events. This past summer they did a fishing outing, and so there's games and activities, meals. I think we can all appreciate the socialization and connectedness that meal times can offer. And so the day centers are really more than just a medical clinic, but they offer an avenue to enhance the social wellness.
Adrienne, where are these day centers located?
So the very back of the address, and they're, at each location that I had mentioned, but,
Okay,
so for example, the one on Millam, the day center is right there,
okay.
connected to the clinic.
Yes.
I have a friend that uses PACE, but I thought she said they took her, I think it's 3 days a week, they pick her up and take her to someplace to pay bingo and lunch, but I thought it was another senior center.
No, that is
It
our
would-
day
it-
center.
It would be one of those,
It would
probably
be.
towards, because, well, I think her address is Kalamazoo, so would she go to Kalamazoo one?
Yeah,
Probably.
it would probably be Kalamazoo.
Yes.
So, how do you become eligible to take advantage of these?
Yes, I will get to that in just
Okay.
a few slides. So certainly the emotional wellness, you know, in terms of, we have behavioral health counselors, we offer in-house counseling, through some really qualified and wonderful people as well. Like I mentioned, the home support, we also have, meal delivery services, which can be a really wonderful thing. Certainly the physical wellness, and then advanced care planning. I was sharing that I have the privilege of being the advanced care planning manager for the organization as a whole. So I go between the sites and centers, and I help our team members facilitate conversations with our participants and their loved ones about their healthcare values and the care that they want to receive and the care that they may not want to receive. And so advanced care planning is not just filling out a durable power of attorney for healthcare. While that is very important and that is a component of it, it's just one piece of it. And so advanced care planning really is this process, and we talk a lot about you know, your goals and how we can ensure as a care team that the care we provide aligns with those goals. And as people age and diseases progress, people's goals change. And it's also not uncommon to talk about what is an acceptable outcome or an unacceptable outcome of an intervention. And as you age and have more life experience, the things that you may be willing to accept certainly adapt as you adapt as well. The goals of advanced care planning, like I said, are really to inform your care team of your wishes, so that if and when you're unable to speak for yourself, your loved ones and your care team know that they are providing care or withholding care that you would want withheld. Essentially, discussion, deciding, and then documenting that. And I think that I had mentioned before, it's an iterative process, which just means it's continually evolving. So it's lots of discussions. Enrollment and eligibility for the PACE program. As a blanket statement, if you have Medicare and or Medicaid, then that coverage will cover some facet of this program. So there are a lot of nuances to income-based care and assets that you might have. And so if you're questioning whether you would qualify from a financial standpoint, I can tell you that it would be best to connect with one of our enrollment specialists. And that information is also on the pamphlet you have. In addition to that, you have to be 55 years or older, and you have to qualify for what we say a nursing home level of care. And so all of our participants, without the support of Senior Care Partners PACE, would qualify to be in a nursing home in the state of Michigan. It was new information to me. While my background was in nursing and I've worked in healthcare a long time, I wasn't familiar with, you know, the determinations of, nursing home eligibility. So, if and when someone has a considerable functional decline and you're questioning, I would say just reach out. There are even things like being dependent on oxygen that can be a qualifier. So maybe you're fairly functioning or your loved one is fairly functioning, but they're on oxygen continuously. That alone would be a qualifying thing. So we have our enrollment specialists that have nursing and occupational therapy backgrounds, and they come out to a prospective participant's home to do an assessment, a physical assessment and functional. Yes.
What about cognitive decline and?
Yes. So another qualifier that is common that we see is cognitive decline. And a fair amount of our participants have some form of dementia or are diagnosed while they're in our program.
But in addition, they still need to meet nursing home level of care.
Yes, and part of that cognition can be a qualifier
Right.
for the nursing home level of care. Yep. So I put a few things up here that you can also find on our website in terms of Medicare and Medicaid coverage and what is typically covered. But again, that is not my area of expertise, so I would recommend if you do have an interest, calling or emailing our enrollment specialists that deal with this day in and day out, and they're very well versed in this. So what if you have a need but you are higher functioning or you don't have any of the qualifications for a nursing home level of care? While PACE is a really wonderful program and we have a lot of opportunity to serve, there are also people that what we say further upstream or not as far along in their disease progression. They're more higher functioning, whether physical or cognitive, but there is still a need. And so the best two options are typically in-home care services, and those can be private duty. And basically what that means is there is no medical necessity that you have to meet. That also means that insurances don't pay for it. So it's not an option to a lot of people that are living on a limited income or a budget. Most of the reputable private duty locations and services will range between $20 and $40 an hour based on what you need. There's also skilled home health care. That is paid for by Medicare, Medicaid, and most private insurances. And that is when there is a skilled need for nursing care or therapy and you are considered homebound. So there are, all caveats to all Medicare regulations. You can still go to the hairdresser. You can still attend your Sunday church service and be considered homebound. But those are often, if you have noticed your loved one maybe is having more falls, as you mentioned, maybe you're noticing a cognitive decline and you need additional assistance, you can talk to your primary care provider about those concerns and say, hey, what about some home care? Can I get a list of private duty agencies that you may recommend? I think one of the biggest takeaways is that when we see a decline in our loved ones or maybe even in ourselves perhaps, whether that is a physical decline or a cognitive decline, it is difficult. No matter how gracefully you handle change and no matter how well prepared you may be for a situation, decline is difficult. And I will share with you, I have cared for the 3 of the 4 of my grandparents at the end of their lives on hospice services. And I share that with you so that you know I have firsthand experience with my professional hat off as a granddaughter. And that care experience, while a privilege, can also be very burdensome. Caregiving is hard, and if you have a limited support network, it is even harder. So I want to talk a little bit about the importance of being proactive. I think these changes are often gradual, and when we're noticing them, weeks or months later, you can wake up one day and think, gosh, this is a significant change from 1 month ago or 2 months ago. And sometimes it can be overwhelming and sort of hit you all at once. And so being keen on taking action when you notice those small changes, as a caregiver in particular, I think is crucial, because it really does take a village. And you at least have your church community to lean on, but there are other resources in terms of assistance and respite to provide you with a break. It sounds so cliche about putting your own oxygen mask on first, but I can tell you both personally and professionally the importance of self-care and making sure that you are in a state of wellness to continue caregiving. So, Yvonne mentioned that we wanted to talk a little bit, or had some interest on Alzheimer's and or dementia. And so I wanted to just briefly talk about this disease. It is very prevalent. And I wanted to just talk about the stages of it, but also some helpful communication tips if you have a loved one that has Alzheimer's. So there are several types of dementia. Alzheimer's is the most common, accounting for roughly 60% of diagnoses. And this disease, regardless of the type of dementia, impacts brain function. So it could be because of plaque formation or vasculature changes in the actual structure of your brain. But over time, this progressive disease continues to limit function and cognition. The stages include mild, moderate, and severe. And in Alzheimer's, the nerve cells in the brain die. You can have a rapid or a slow decline, but it is a progressive illness that ultimately leads to death. Mild dementia is characterized by memory loss. You may notice small personality changes, things like struggling to make a grocery list, struggling to go to the store and find the items on the grocery list. Similarly, trouble following steps to pay your bills. And then as that transitions to moderate, those things become more pronounced and more noticeable. So maybe the things that you were just kind of brushing off or putting on the back burner become a little bit more pronounced and in your face and a little harder to ignore. So people with moderate dementia may begin to wander, which is certainly a safety concern. There are some really wonderful programs called Miles for Memory, and ways that you can get bracelets and tracking on, so that if that is a concern, you can find your loved one. And then also inability to sequence things, forgetting how to brush your teeth or how to function to be able to get into the shower, and may or may not have beginning of incontinence of bladder and bowel. Severe dementia requires assistance for essentially all activities of daily living, and the individual suffering from severe dementia eventually develops typically issues with swallowing. Communication problems. Communication with someone with dementia can be very frustrating, not just for you, but also for them. And so they have a lot of trouble with, loud background noises, inability to just carry on a conversation. I think all throughout our lives, we're kind of trained to ask questions that elicit a response or open-ended questions. And in this case, with someone with dementia, you want to simplify things. And so you want to talk in a very calm voice because the tone and volume of your voice matter. And you want to ask yes or no questions, which is hard for most of us, I think, especially if it's someone that you're relatively close with and you're used to having robust dialogue with them. What you can do is connect with your loved one, get down to their eye level, use their name, and allow time. That's another thing that I think we have is a struggle for a lot of us. We can be in a hurry, we can just be ready to move on to the next thing, and you really have to take a step back and slow down, allow time for them to respond, not interrupt, because while you're interjecting or repeating, they may be just on the verge of forming their thoughts. And so encourage two-way conversations. Again, be aware of how loud your voice is and your body language. One thing that works wonders is distraction and diverting attention. So maybe taking them to engage in an activity that they have loved. So redirecting is also a very helpful tool. You can encourage communication by letting them stay involved in decisions as appropriate. Again, challenging. Holding their hand when you speak to them, and if you become frustrated or when you become frustrated, making sure that you take a time out for yourself too. Some of the ways that we can speak effectively to someone with dementia, no matter how far their disease has progressed, don't talk about them as if they aren't there. They are still a human being, and that is just part of, providing high quality care with dignity and acknowledging their presence at a minimum. So, you can repeat instructions if necessary, and simple step-by-step instructions are very helpful.
I can hear them out there.
Oh. Instead of pointing out mistakes or saying, don't do it this way, put a positive spin on it and say, well, let's try it this way. Thank them for helping, even if it is not the desired outcome. And again, doing so in a calming and reassuring voice. Instead of asking questions like, are you tired? How are you feeling? And in-depth questions, just, are you tired? Let's go lay down. Or instead of asking, what would you like for dinner? You can say, dinner's ready now. Let's sit down and eat. And very concrete, simple steps for them. Limit the number of choices. And as hard as it may be, try not to say things like, don't you remember? Or I just told you. It's very frustrating for them because they literally don't remember because their brain is changed by this disease. And so understanding that it is the disease and not the person can be helpful as well. The biggest thing as dementia progresses is to focus on remaining ability. So even if it is, all they can do is sit up in a chair with assistance or drink from a straw when you put it to their lips, those are things that they can still do. And so focusing and asking yourself what you can do for your loved one is the very best thing that you can do. There is a really wonderful documentary called Alive Inside I honestly can't remember what streaming service it is on. It's about an hour and 20 minutes. It is a very powerful documentary about the power of music and the way that music enters our brain and the location of those long-term memories are some of the very last to be touched by dementia. And so if an individual is even unable to communicate, unable to speak, if you put their favorite old tunes on and they can hear that, you can see the change in them and they really come alive and even may begin to speak in full sentences. It is really a miraculous thing to see. And one of the things that we do in our program is find out what kind of music that our participants with dementia really like, so that when their disease progresses, we can use that as a tool. It also brings a lot of comfort. And this documentary is about a gentleman that goes into long-term care facilities and helps people through music therapy, and it's really cool. And you might cry. Helping strategies and preventing burnout, like I said, are key. Certain programs, including Senior Care Partners PACE, as well as hospice, which I will talk about, offer respite. And so while nobody likes change in routine or feeling like they can't meet their loved one's needs, sometimes you really just need a full reprieve where your loved one is cared for so that you can have an opportunity to decompress and reset. And we work to do those proactively to keep you well versus a reactionary thing. As I had said, I have spent a decade of my career in hospice and end of life. And one of the things to understand about hospice is that it is a philosophy of care. It's not a location. So most hospice care in the United States takes place in the home setting, a routine home care level, with the support of loved ones or a 24-hour caregiver. There are also higher levels of care for symptoms that cannot be managed in the home. And then there are also hospice homes or hospice houses where if someone has no other caregivers or an inability to remain in their home, that may be an option. There is typically a room and board cost associated with a hospice home. So depending on your Medicare and or Medicaid coverage, there may be a room and board fee. But hospice focuses on quality of life, peace, and comfort. The qualifications for hospice require you to have a life-limiting illness that if your disease progressed at its normal course, you would have 6 months of life or less to live. Also, signing on to hospice means that you are no longer seeking aggressive or curative treatment measures. It does not mean that you are throwing the towel into your remainder of time here on this earth. It really is about improving the quality of your life for your remaining time and really putting supports and services in place so that your time can be meaningful and time well spent connecting with your loved ones and doing things that you enjoy.
Is PACE a hospice provider?
We provide certain facets of end-of-life care, but we also contract out to local hospice agencies like Centric Care. So we do not have a formal end-of-life program, and so depending on the participant's needs and the family's needs, we may pull in hospice services as well. And that's, you know, not an extra charge or something, that's all covered under the PACE umbrella of care. Typically, hospice is covered 100% by Medicare. I've worked with some very young participants that don't have Medicaid or Medicare, and any insurance typically has good hospice coverage here. Some of the services offered, nursing, social work, spiritual care, massage therapy, music therapy, certainly medical care for symptom management. And as I had said, the goal of hospice really is to support quality of life, whatever that looks like for each individual, in their home, typically, until the end of life. And then once a participant passes away, hospice also continues to offer bereavement services for their loved ones for just over a year after their passing. And then also grief groups and support groups. So I want to be cognizant of the time and allowing time for discussion and questions. I hope that some of this information has been meaningful to you. I did pass along the PowerPoint, so if anyone wants that emailed to them, that's not a problem. And then if you have other questions as your care series goes on that are unanswered, you're always welcome to reach out to me, and if I don't have the answer, I can probably find it for you. Do you guys have questions?
Go ahead. I know it said a monthly, once you sign up, then you pay by the month?
For PACE?
Yeah.
No, it is actually like a managed care model. So the dollars come from CMS, Medicare, Medicaid. If you did not have those and you were paying privately, it would be on a monthly basis. And I will just be very candid that the cost of that is the equivalent of paying privately for an assisted living, and it's rather costly, depending on the participant, between $4,000 and $6,000.
So it's not menu driven. If you come to the adult day center 1 day a week or 5 days a week, you pay a set monthly fee?
Correct. And the care, in terms of how frequently you come, is really based on your needs.
So if you only need one of these things, you probably wouldn't go through PACE.
Correct.
Because you buy the whole package.
Right.
Oh.
Yeah. Yep.
Okay.
Yes.
Does PACE then replace the Medicare plan that you would be signing up for? Is that how it works?
Yes. So you would have all of your care provided and doctors through the PACE program. The exception to that is specialists that we contract out. So like I had mentioned, hospice care or cardiology, surgical services. If our participant needs a surgery, then we contract those out.
I'll just add, my mother is in this program, and I just want to let everybody know if anybody has any questions. It has been a wonderful program for her. And in her situation, it's different as far as becoming, at least it was, and she's in it, but becoming Medicaid eligible for this program. It's based on only her income, not the family income, and it's different Medicaid rules. But then, she pays nothing. All of her medical is all part of the PACE program. I mean, it's all managed by them. You turn over the care to them, and it's been wonderful. And my mom, my dad was the caregiver. PACE came to her house, their house, and unfortunately, my dad passed before my mom. It was the classic, the caregiver died before, probably it was just so much on him. But it's been a great program. My mom is now at Heritage in the memory care unit there, and PACE has followed her. That's not PACE's intention. They want to keep you at home, but they will, if that doesn't work, because my mom's advanced dementia, they did follow her to that program and are taking care of her there, and that's covered by them, other than what she can pay through her social security. So anyway, I just wanted to add a little real life color. I'm happy to talk to anybody about my experience, but it's been very good.
I'm glad to hear that. And it also covers any emergency care. So if you go to the hospital or you're hospitalized, have an emergency room stay, it's all covered under PACE.
So just to clarify though, the Medicaid versus Medicare.
Yes.
So if you want to qualify for the Medicaid and then you have no cost, that's one route. But you can still access PACE Care services through Medicare if you sign up for them
Correct.
as your Medicare provider.
Correct.
And then you pay a monthly premium like you would for any other Medicare plan.
Yes, and what our enrollment specialists do is if you are missing a piece of that Medicaid coverage, they will help you fill out the application before you enroll so that you are paying as little or nothing if possible.
So you
But I think it's a little confusing with the Medicare
Well,
thing.
because I've always heard it's just people that you have to qualify for Medicaid to be able to get into the program was what my understanding was. So I didn't understand that you can access the program without being on Medicaid. You just have
You
to pay.
can, but there is an additional cost to it.
But you
Yeah.
could have Medicare only, and then as you progress, become Medicaid eligible also, and then have Medicare primary, Medicaid secondary.
Correct.
So you might not start out with the Medicaid, but as you deplete your assets, you might
Right.
become, okay.
But the 4,000 to 6,000 you mentioned, is that even if you have Medicare?
No, that is just
That
if you
like
have.
you're under 65 years old, so you're not eligible for Medicare, and then, because anybody over 65 would have Medicare.
Right.
And so the premium, if you're not Medicaid eligible, but you're over 65, you don't know what that premium is, or what it costs?
I
for-
do not.
Okay, because that's probably the biggie that we would
Yeah.
like to know,
Yeah.
right? So,
Sure.
because that's most of the people probably in here,
Probably
so.
depends which Medicare package you buy,
Well, sure, but if you're Medicare eligible, you can at least figure out what,
the max would be.
yeah.
Yeah.
What percentage?
We might want to circle back and get those numbers.
My question is, the meeting nursing home level of care, where could we find that, the state criteria?
It's online. If you
On what,
if you Google nursing home level of care criteria,
okay,
there's something that is called LOCD guidelines, and it's local coverage determination. And that's not just for nursing home level of care, but any level of care.
so is it often the case that people we're caring for in our own home meet that, but the natural resources in their network are filling that gap? So if you think, oh, my husband we're fine at home, he's not nursing home eligible, and then you think, oh, but would he be fine without me?
Correct.
Then people we don't think of necessarily as severe because so much family's helping out may actually meet this criteria. Okay.
You're correct. And that was a big shift for me when I joined the PACE program as an employee and started working with some of our participants. I think a lot of times with the care and support of loved ones, you don't really realize all that you're doing and all the caregiving that you are providing. It's a good question.
I would like to add just a little 2 cents from, I'm a paramedic in the county for the last 10 years, so something just on this topic is I would encourage you all to have a very detailed conversation, both with PACE and hospice, on their relationship with emergency care, because I have seen emergency care go delayed or completely unrendered because of a miscommunication or a misunderstanding of, oh, I'll lose hospice if I go to the ER, or, well, I need PACE's permission to go to the ER. So just have that clear conversation so you know exactly what you can do in those situations and what's most appropriate for you and your loved ones.
Yeah, that is a really good point. And I will just tell you from an administrative perspective, you always have the right to go to the emergency room. Even if you are on hospice care and you don't feel like your needs are being met, or, we don't want to send participants to the emergency room, but you may fall and break a hip God forbid, and that changes things for you. So you always have the right to go and seek that emergency care if you have unmet needs. But that's a good point, and I appreciate you bringing that up.
Are there any other questions?
What are we doing with time?
Don't be
Yes,
afraid
Lori?
to ask, 'cause this is the time.
Just a home care question in general, so, I mean, that's like a 24/7 option, correct? Like as far as, it's not like a Monday through Friday or.
We do have services on the weekend as well, so specific to the PACE program, early in the morning to as late as 8 in the evening, but we don't provide overnight care. I don't know if that answers your question fully.
Yeah, I just wonder, cause, you know, when you start on that journey and you're trying to figure out services, the question becomes, well, like, oh, I can't really call them on the weekend, or can I, or, you know, how does that all work?
Sure. So we always have a nurse and a doctor on call 24/7. So the nurse may triage it, and if it's the middle of the night and there's, you know, a provider unable to go out, they may send you to the emergency room. If they can't, kind of triage and symptom manage over the phone. But there is someone available by phone, and there's, like I said, a nurse and a doctor on call 24/7. Holidays, always.
But, this program doesn't provide 24-hour round-the-clock
Correct.
in-house. What do you provide, what do you come into a home to do? Like, what would be a maximum number of hours somebody would get?
There is, I'm not familiar with like a cap or max hours, but for participants that have really, really high needs and very limited support system, it's not uncommon to have a member of the care team in every single day. Whether that's someone coming in the morning to help them get up and get dressed and get situated to eat, and then returning in the afternoon. So while it's not 24/7, it can be morning, noon, and night based on need.
So, but that, I think this other criteria must be able to live safely in the community. That rules out somebody who can't be left alone and is alone. So you might go to this, you might join this program if you have a spouse that cares for you, because you're able to live safely in the community with family support.
Mm-hmm.
But without that family, you
would
are not,
be safe.
you would not, so then you would not be eligible.
You would certainly be eligible with those. And one of the things that I really appreciate about the PACE organization and model of care is really allowing our participants their right to autonomy. And, you know, as long as they don't have a cognitive decline that would impact their judgment and decision making, you have the right to remain in your home.
Right.
But a good question. Was there another question?
Just to clarify, so your program does not provide services on weekends, is that correct? It does during the week, but not of all of these kind of services.
We do have some home care services on the weekends. Yeah.
Okay.
Yeah.
And those are usually contracted out,
No, not necessarily. Those can be PACE provided.
pays provided as well.
Yeah.
Is this program just Kalamazoo County, the entire state of Michigan? Does it extend out?
It's a nationwide program, and in Michigan there are, I believe, 17 centers or organizations. So wide coverage in terms of, you know, by county. But if you Google it online, there's also coverage areas, and so Portage, Kalamazoo, Battle Creek, and then we also have to the east and west of us and north other PACE centers.
Yes.
Yeah, if you have long-term care insurance, how would that be affected?
I do not have the answer to that question. It's a good question though. And I know we've had participants that have difficulties too if they have a family member that may be paid through the state for caregiving, and then sometimes those dollars can be negatively impacted as well, and they may lose a portion or all of that. So that's why I always defer to our eligibility and enrollment specialists, because they really go through each participant's unique needs.
But I would probably say your enrollment specialist would know the answer to
Absolutely.
her question.
Absolutely.
Right?
Yeah.
I have one real quick. You mentioned twice that the centers are in Portage and Kalamazoo, but they're residency based. Do you have to live in those two communities, or does it cover all of Kalamazoo County and those are the two service points?
It covers the whole county. Those are just 2 service points.
Thank you.
I think of some of the things that you've said, Adrienne, today, and I think about the fact of having conversations probably is one of the most difficult to have, and then how to progress with conversations as one, gets older and can express your needs to your family and to your support systems. You mentioned a little bit earlier that you have some ways of helping people do that, carry on and teaching people how to do that.
Yes. So we have a core group at PACE, which are the providers, the registered nurse care coordinators, our social work team, and spiritual care providers that have all taken special training to be certified facilitators for advanced care planning. And so, like I had mentioned, I started with the organization in April, and that's my mission, is to educate this team on having more robust advanced care planning conversations.
Those services aren't available till your family member joins PACE.
Correct.
Mm-hmm.
Yes. And there are other avenues to that. I was sharing that I think that it's something that I'm very passionate about, because I've seen when people don't communicate those wishes in advance. And so even getting online, and there's a program called Making Choices Michigan, and that has information on durable power of attorney for healthcare forms, and they're very geared to be health literate for a wide variety of people, but there's good conversation starters with that, to getting your wishes on paper and choosing an advocate. So thinking of someone that you would trust to speak for you if you lost your ability to speak for yourself.
Question. If someone was in the program and they were, let's say, visiting a family member out of state or whatever, would they be able to participate be helped by a PACE in that state?
Potentially, yes, if there is
Let's
one
say-
in the
yeah, if
area,
there's one
or
in the area.
yeah.
Yeah, I think too, maybe Adrienne, you can address this, that there are also, I know there are nurses and social workers in private practice in various states that specialize in their practices in geriatrics, and they also are pretty good at, of course you have to pay for the services, but if you have somebody that can be a case manager that you can trust in another state, that's another option.
My friend, I would not say she's nursing home level care. She's been in this like 2 years. So can you be in it just for the social part of it, or is that, I mean, is that how you test them to know if they're nursing home level of care?
No, it's physical and cognitive assessments that are done. Good question though.
But that person gets a lot of unpaid support, Diane.
Huh?
Without people from the church stopping by, without the support from her family, you might be surprised how
So that's
disabled
nursing home. That would
she
be
is.
nursing home.
Yep. There's lots of ways to be eligible. Yes?
Okay, are there any other questions?
Thank you so much for having me, and like I said, if there are questions that come up after the fact as you mull things over, or other questions that aren't answered in your care series, please don't hesitate to reach out.
Thank you, Adrienne.
Thank you so
So I just wanted to let you know that, next week, we're gonna have senior and veteran services, discussion, and it's, Lynn McFarland from Community Outreach, the Milestones, Senior Services Group. And, she's gonna talk about how you can get home repair, Meals on Wheels, and other things that you need to be able to keep your home up so you can stay in your home if you wish. And we may have an extra speaker who's going to talk specifically about veteran services. We're still trying to work out whether we can do that or not. So I thank you for being here today, and I put my email address up there. I encourage you to send me whatever comments you have, because what we thought was that this